at the University of Nottingham, and we're going to be looking at a case today to look at the appearances of the central vein sign, which many of you will have heard about, but I'm sure many of you also are wondering what it is you're exactly supposed to be looking at on the scans that you've been acquiring. We've been doing this type of scan here in Nottingham for a few years now and have been using it in our new MS diagnosis cases and using it particularly as a problem-solving tool. So I think we've got a reasonable amount of experience of using the central vein sign in practice. So up on the screen here we've got two scans, two sagittal images from a patient with MS, and I'm just going to scroll through the volumetric FLAIR acquisition on the left-hand panel here, and you can see some fairly typical MS lesions, the T2 hyperintense lesions, seen particularly involving the periventricular white matter. We can see some lesions, some small lesions in the corpus callosum there. And as we scroll outwards, we can also see there are a few more peripheral white matter lesions dotted around in the white matter. So it's a fairly typical case, and certainly these appearances just on the FLAIR would have you suspicious that this could be a person with MS. So I'm going to now just talk about the appearances on the susceptibility weighted imaging, which we've got on the right hand side of the screen. Again, this is a sagittal acquisition. When you are looking for the central vein sign, you do need to use a SWE acquisition, so susceptibility weighted acquisition, and there are a number of different types of SWE available on the MRI scanners, and they vary a little bit between the different manufacturers. The sequence we've been using here is a very nice 3D sequence that has been optimized for central vein detection, and as we scroll through the image, hopefully you'll be able to see the features that I'm talking about. Let's just find a couple of lesions on our FLAIR, and we'll see if we can find the equivalent lesions on the susceptibility weighted imaging. So here we've got a few lesions in the frontal lobe, a few slightly quite small ovoid lesions, and if we now look at the equivalent slices on the susceptibility weighted imaging here, you can see we're at a similar point on the sagittal image. We've got a little bit of the sulcus just running through the image there, and then down here we've got our lesion that has a very clear little black dot in it, and this is a very nice example of a central vein. And we can see the veins running through the parenchyma elsewhere, but here we've got one sitting right in the middle of the lesion. And actually, when we start to look at some of these other lesions that we've got, although quite small, we can also see some very clear central veins. So there's another one up here, and within this lesion here, we've also got a small visible central vein. And in fact, as you scroll through the image, the more you look for, the more you see. So again, we come a little bit further back here in the parietal white matter. We've got this ovoid lesion here. It's got a slightly larger lesion adjacent to it, but we can see this very clear central vein running through the lesion. And when you get the lesions in profile, they appear as a dot running through the lesion, but also you can catch them running along their long axis. So if we come to the lesion here, for example, another parietal lesion, ovoid, when we look over on the SWE, we can see very clearly the vein in profile running through the lesion there, giving what's been described as a coffee bean appearance. You can see nicely there. And one of the nice things about this sequence is because it's a high-resolution volumetric acquisition, we can flip it into different planes. So I'm just reformatting it now into the other planes. I think it's going to come up as an axial sequence. And let's just zoom in a little bit here. So if we just scroll up a little bit higher, we can start to see some of these lesions here, for example, in the left parietal lobe. You can see an ovoid lesion, just in the window a little bit more harshly. You can see the central vein running through the lesion, another one over here on the right hand side. Very nice example here in the left frontal lobe. So these are the typical lesions that we look for. When I'm looking at these scans, I do a count of the lesions. In fact, what I will often do as I'm going along is put a little marker on the lesion, so that I can come back and double check if I need, but also so that if I lose count as I'm going through the image, I can then come back at the end and tot up the number of arrows that I've got on lesions to see if I've got 6 or more lesions that I could use to help support the diagnosis. I mean, there are various criteria that have been published for diagnosis of MS based on lesion counts and lesion proportions. I've got to be honest, I don't tend to go for the percentage or proportions of lesion count, because you then have to count every other lesion in the brain to work out what your proportion of vein positive lesions is. But the rule of 6 is one that I will often use and discuss with my neurology colleagues in support of the diagnosis.